for fat grafting in the mid-face and lower lids. Probably the most predictable area to achieve fat grafting, at least in our experience and according to the literature. So I like to have my first where we go through the 18 gauge night core needle about 1.5 centimeters below the orbital rim. So you're able to come up on an angle this way, and then right just lateral to the oral commissure, a couple of millimeters, so we can service the mid-face, if you will, include a piriform aperture. So the first thing I would do is make a little, so again, I think it's important to treat these areas together. A more youthful lid is a shorter, fuller lid, so why wouldn't we add volume here and in the mid-face together to rejuvenate? So I make our little incision, a little stab incision there, and this is a, we believe in centrifuging the fat. It's been harvested in centrifuge. This is a 0.9 millimeter. You can see this 0.9 millimeter tulip. It works really well. It cuts down on bruising compared to the larger ones. We'll use the 1.1 millimeter lower in the face. And I know some people say you should never be superficial to the orbicularis, but my feeling is we're trying to deliver this in an area where there's a really good blood supply, which we know is the muscle. So I do actually go my first 1 cc superficial to the orbicularis muscle. And the key is a very, very slow delivery. So if I'm in and out, if you're talking about depositing or too much, in and out about 3 times for every 0.1 cc that's delivered. So I do about one, and you can see it's right under the surface of the skin. And I actually feel this. I palpate it with my thumb on the contralateral non-dominant hand. And it's a very, very, very slow delivery, superficial. So once I've done 1 cc of that, then I go back and actually go deep to the orbicularis with my second and third syringe, typically no more than 2 or 3 cc's per eye. And already you're starting to see this fill a little here. So now what I do is I go down deep, and I'm right on the orbital rim, just kind of softening that skeletonized bony tissue, carrying it out toward the arch a little bit too. And again, very slow delivery. This is how you don't end up with fat granulomas. And I always feel like I have to stick up for fat grafting in the lower lid, because done well is just not problematic. We've been doing it since 2003. This is being filmed in 2016, so 14 years now. And we do lose a little volume with time. You're already starting to see in the camera a little bit more rejuvenated left lower mid-face lid complex. Okay, I'll take a little bit more, please. And so typically 2 to 3 cc's here. And don't forget too, it's not just about filling out here laterally. We lose volume in the central part of our face as well. And typically I do between 4 and 6 cc's per side, depending on the patient. Okay, here we go. Carrying this laterally now. Really trying to feather it out so we're not depositing it all in one spot. No core needle, please. Okay, this is now I'm carrying this from the midface up on, and I'll use a larger cannula, the 1.1 millimeter cannula here. And again, remember that the piriform aperture becomes larger as we age. So I will deliver some around the piriform aperture. Again, this isn't about filling folds, it's about revolumizing. How much we have there left, Zuli? 6. So we'll use that for the other side. So I just want to demonstrate this lower lid, mid-face. Basically do the exact same thing on the contralateral side. So anywhere from, and again, really feathering this out. And this is basically the technique we use in the entire face. Very slow delivery, but the slowest is really in the eyes. You can already see in that video that she looks much more rejuvenated. We've taken out some of the pseudo herniation of orbital fat, but you see this side is much more drawn out.